When you arrive at LifeQuest Modern Facility in downtown Toronto, you see we know that having a baby is your first priority. Our priority is to help you realize this dream. When it's time and your family doctor or gynecologist refers you to LifeQuest, we take over. Everything happens here, from your blood work in our on-site lab to your ultrasound scans. LifeQuest has you covered in our comprehensive medical center. I'm Jocelyn Smith. I'm the nurse manager of LifeQuest. I'm going to show you what makes LifeQuest different from all the other reproductive healthcare centers. First, there's LifeQuest's highly trained team. We're committed to your health and have a record of success treating infertility.
There are a number of approaches to take, and what I'd like you to appreciate is that we're going to do this in a methodical way. You need to be patient. You don't want to suddenly jump into some high-tech IVF, in vitro fertilization, which you simply may not need. I will tell you what I think your best choice is, and I will give you options. You choose what you are most comfortable with, but I will always tell you where I think you should be going.
Dr. Carl Laskin is one of the founders of LifeQuest and affiliated with the University of Toronto. Together with Dr. Ken Kadeski, medical director and LifeQuest's other founding partner, they're Canada's foremost fertility specialists.
IVF is appropriate, and it's a successful tool if we dot all the I's and cross all the T's beforehand. Once we fertilize, we create these pregnancies. We then nurture them over the next 5 days. The woman's been pre-prepared to accept these embryos, so she comes back to the same room.
We tailor treatment programs for every couple. Your eggs, stimulated through a carefully monitored cycle, are gently retrieved, then carefully examined and fertilized in our embryology lab with the use of a high-power microscope. The process is called ICSI, where a single egg is fertilized with a single healthy sperm. Advanced 5-day transfers, also known as blastocyst transfers, are possible because once eggs are fertilized, they are carefully stored in incubators and monitored daily as the embryos develop. Daily monitoring ensures the healthiest possible pregnancy. On the 3rd day, if pre-implantation genetic diagnosis or PGD is required, potential abnormalities are discovered, ensuring optimal health for your baby. LifeQuest manages more PGD cycles than any other clinic in Canada. Our lab director, Jim Mariano, is developing new techniques and setting new standards, shaping the future of reproductive medicine in Canada. In fact, the LifeQuest lab is so well respected that fertility doctors from other clinics use our lab facilities for their own patient procedures. Our technology is better, and our pregnancy rate is higher. It all adds up to a better chance of taking home a healthy baby. And we also know couples will face a range of emotions. That's why we are the only clinic to have a registered counselor on staff. Sherry Dale specializes in infertility, miscarriage, and couples counseling. She knows what you're going through because she's been through it herself. Her 2 children were conceived here.
You can also start to feel pretty nervous about what's at the end of this process. So we want to give you some practical tools in how to cope with it.
Caring for you is our goal, and it's what distinguishes LifeQuest from other centers. An on-site lab provides a technological advantage. Blastocyst transfers increase the probability of pregnancy and reduce the risk of multiple births. PGD provides a sophisticated prenatal benefit for couples, and in-house counseling helps reduce stress. The LifeQuest team is with you through it all, right up to your final visit when pregnancy is confirmed and it's time for nature to take its course. At the end of it all, what makes us feel best are when couples get pregnant and they come in and say, "You know what you're doing and you took good care of us." LifeQuest. When it's time, we're here.